I'm a psychiatrist in San Francisco with a mostly psychotherapy practice. Early in my career, I was a psychotherapy researcher, and for decades I've taught psychiatry residents, that is, doctors specializing in psychiatry, about psychotherapy. This is the fourth video in a series I'm doing on psychodynamic psychotherapy. And I'd like to focus this week on personality disorders, what they are, and how psychodynamic therapy can help. I'm Dr. Stephen Reidbord, and this is More Than Meds, where I talk about psychotherapy and psychologically informed psychiatry. Some people are uncomfortable talking about personality as something that can be disordered. It sounds like a personal insult, not scientific. But if you think about it, there are people who go through life setting themselves up over and over for misery and trouble. They make themselves miserable, or they make everyone miserable around them. And it just seems to be part of who they are, part of their personality. Most experts see personality as a matter of degree. We all have tendencies in one direction or another, usually mild tendencies. And then a minority of us have really much more pronounced tendencies in one direction or another. The different factors or traits that go into a person's personality, and here's a chart of one very popular scheme of this called the Big Five, or the five-factor personality theory. These different factors or traits that go into a personality are different for each one of us. We have a little more of this or a little less of that, giving us each a unique personality that's not exactly like anyone else's. I'd like to give you some examples of personality disorders to give you an idea of what this means. There are people, for example, who are so obsessive, so detail-oriented, that they get lost in the details. They can't see the forest for the trees. When this is more extreme, we call that an obsessive-compulsive personality disorder. There are people who have such a need for admiration that they're hopelessly self-centered, and they view others not as independent people, but really only as instrumentally, only as it relates to themselves. And such people we call narcissists, or we say they have narcissistic personality disorder. There are people who are chronically paranoid, chronically suspicious of others, and if this is part of their personality, it's baked right into who they are, we say they have a paranoid personality disorder. There are people who view the world only in crude categories, good and bad, black and white types of categories, missing all the shades of gray in between. They miss all the nuance of life because they see things in really extreme ways. Often those people as well have overwhelming feelings. They feel they can't handle, and sometimes they cut or burn themselves to actually get some relief over those feelings. And we call that problem borderline personality disorder when it's fairly extreme. And finally, there are people who seem to lack any sense of guilt or remorse, and they hurt or exploit other people without a second thought. And we call that antisocial personality disorder. These are just some examples. There are more such personality disorders, but I wanted to give you an idea of examples that count as personality disorders. One way to view personalities is as solutions we developed in childhood to deal with stress, to solve a problem in the outside world, in our family, around us, or a psychological conflict that was internal and troubling. One child focuses on a lot of details to try to organize a world that feels out of control. Another learns to reinforce a shaky sense of self-esteem by getting positive feedback and admiration from the people around them, and they learn to rely on that. They keep going back to that in order to feel okay. Another child develops a depressive outlook to always anticipate the worst, so it never comes as a surprise. And another splits, sees the world in these extreme categories in order to make sense of a world or their own feelings that would otherwise seem completely chaotic and out of control. Personality disorders and psychiatric issues in general can be divided into ego-syntonic and ego-dystonic. These are complicated terms for a very simple idea. An ego-dystonic problem is one that the person doesn't want to have, like depression or anxiety. They want it to go away. They want to go get help for it. But there's a lot of things in psychiatry that are ego-syntonic, but we still consider a disorder. For example, a person who's very narcissistic doesn't usually think being narcissistic is a problem. So they don't ever come to a therapist and say, please help me, I have too much narcissism. That just doesn't happen. Instead, those people are either pressured by family and friends around them, you really need to go see somebody, or the consequences of their personality style end up hurting them indirectly. So they seek a lot of external validation and support and don't get it, and then they feel bad because they haven't gotten what they're seeking, and then that might lead them to go to seek help. But in general, people only seek mental health care for ego-dystonic problems that they don't want to have themselves. So although medications and symptom-focused treatments like cognitive behavioral therapy can treat the surface symptoms of, for example, depression and anxiety, only depth psychotherapy, like psychodynamic psychotherapy, really treats personality disorders themselves. According to psychoanalysis and psychodynamic theory, which derives from psychoanalysis, this is not done by teaching the patient or the clients tips, tools, or strategies for how to manage their feelings, but instead to go beneath that. It's accomplished through a combination of gaining mental and emotional insight about what's going on in one's own mind, what's behind their personality style, as well as the healing nature of the therapeutic relationship itself. In childhood, each person's personality develops in the context of interpersonal relationships, mostly parents or other caregivers. Likewise, healthier shifts in personality in adulthood occur in the context of healthier adult relationships. Sometimes strong, healthy friendships or strong, healthy romantic relationships can be healing in this way. You often hear of people who've had a series of romantic relationships say that each one has gotten better. And indeed, that might be the case because the person has healed some of their personality issues in the course of those romantic relationships. That doesn't work so well for their partners, but the truth is that those relationships themselves can help the person develop a healthier personality over time. The problem is this can take a very long time and lead to a lot of heartache. It can take years or a lifetime to find one or more healthy relationships in everyday life. Instead, a professional relationship with a psychotherapist provides this healing relationship and contains it within the therapy so that it doesn't cause drama in the rest of your life. The therapist knows what they're doing, so the relationship is more apt to be healing and helpful. Depth psychotherapy can actually shift a person's personality style. It's what psychoanalysts call structural change. But it's important to realize that no one goes into psychotherapy or psychoanalysis with one personality and emerges with a different one. It's a lot more subtle than that. These are not dramatic shifts. As I've said in some other videos, it's a bit like a ship or an ocean liner changing course just a few degrees. It's not a big change in heading, but it leads to a totally different destination. Or another analogy that I sometimes like to use is that psychotherapy sands the rough edges off of a personality. It doesn't change the shape of the personality completely, but some of the more problematic aspects or some of the more troubling parts of it are mellowed out or sanded off in some ways so that the person is more comfortable and actually the people around them are more comfortable as well. This is nothing to be scared of, by the way. Nothing in your personality will change in psychotherapy unless you yourself consider it an improvement. One of the best and most useful aspects of psychodynamic psychotherapy is working with and helping to ease the problems of personality disorders. While most people seek psychotherapy for depression or anxiety, these can often be surface signs of problems that are more wide-ranging, that are kind of baked into the person's personality. As a practical matter, if you find relief for your depression or your anxiety through self-help, through relaxation exercises, through cognitive reframing, and so forth, well, that's great. That's wonderful. But if you find that those kinds of approaches don't really get at what's going on, then it's time to consider something that goes deeper, something like psychodynamic psychotherapy. It's a treatment that looks at the whole system, you as a whole person, your whole personality. It's a treatment that approaches a serious, complex problem with respect for complexity and nuance. It respects you as a complicated person with complicated, maybe conflicting feelings that you have all at once. Psychodynamic therapy does this by embracing complexity, not by oversimplifying. It assists in your search for insight and provides a consistent human relationship that's specifically designed to be healing. Well, that's it for this week. Please share your ideas and comments below. Please like this video, but only if you really like it. Please subscribe if you have not already. And this video is part of a series I'm doing on psychodynamic therapy, and there's the playlist. Thanks, and I'll talk to you next time.